This case illustrates the risks with simple sulcus placement of intraocular lenses. After posterior capsulotomy, this patient came to me with this subluxated sulcus placed lens with vitreous around the edge of the optic into the anterior chamber. Obviously, the vitreous pressure had pushed the lens eccentrically. So we did vitrectomy, and the lenses, the haptics of the lens are still in the sulcus, but we're clearing the vitreous to avoid that vitreous pressure. And then we're going to attempt membrane optic capture to stabilize this lens. The opening in the membrane is judged to be appropriate for membrane optic capture. So we're keeping the chamber maintainer there with the irrigation port while we manipulate the lens. If the opening is somewhat oval, I place the haptic optic junctions in the long axis of the oval. And one can also look at what rotational position will allow the best centration, because the haptic optic junctions are going to determine centration. Then it's a matter of just pushing one side through the membrane and then the other side. There it's slipping under. And then it's nice to confirm by just maneuvering the membrane to make sure that it's on the anterior surface. And we've achieved membrane optic capture to stabilize this loose sulcus lens. Here's the appearance 1 day postoperatively with a perfectly centered and stable sulcus placed lens with optic capture.